I just had sinus surgery a few weeks ago. Let's break it down financially. Spoiler alert, it costs a lot. The American healthcare system is broken, and I'm actually one of the really lucky ones. Let's get into it. This was a low-risk 30-minute endoscopic sinus surgery. The reason I had to have it was my right sinus was 95% full of a pustule that was also covered in fungus. So that's gross. That had to go. And I was getting sinus infections like 4 or 5 times a year. It's not fun. Let's go from smallest to largest in cost. First, I had to have some labs done post-operation / during operation to make sure they got all the fungus and stuff. They sent it to 2 different labs and I got a bunch of different results. It was all clear, and one of those cost $186 and then the other cost $108, which totals to $294 in labs. Next, I have my ENT come and do the procedure at the hospital. That costs $1,633. So for the anesthesia itself, that costs $1,650. And then for the anesthesiologist to be there, that costs $1,630, totaling to $3,280 for anesthesia. And for the surgery itself, actually at the hospital, using their facilities, using their other staff, that costs $11,512, all of which totals to $16,422. Again, my procedure was thankfully uncomplicated. I will say that does not include my pre-op and post-op appointments, which would rack up the total a bit more, considering I've had a little bit of a rough recovery. How much did I pay for all of this? $0, because I've already met my deductible for the year and I'm lucky enough to have good health insurance. I want to have a good call to action at the end of this video, but I don't really have one because this is a major issue affecting a lot of Americans, and all of which I'm just trying to say is like, something should be done about this.